Hi, viewers. Thank you for watching Coherent TV. This is the Pillow Talk Show where we discuss SRHR related issues affecting the youth, the women, and the men in the country. Don't forget your host. My name is Nale Fiona. And well, today in the studio, I have two beautiful ladies with me before they introduce themselves to you. Today, our topic of discussion will be rotating around family planning, involving both parents and their children. Well, right now, let's know our guests so that they can introduce themselves to you. Then we shall know what is next. Hi,
Hello,
how are you?
I'm good. How are you?
Nice to meet you.
Nice to meet you too.
What is your name?
I'm Miriam.
Miriam. Nice to meet you once again. Hello.
Hi,
How are you?
I'm okay. How are you?
You're good.
Yeah, I'm good.
How do you feel about being here?
I'm feeling good.
You're feeling good. What is your name?
I'm Hamira.
Amira. Oh, nice name. Hajati. Nice to meet you too. Our viewers, don't forget this is a Pillow Talk. Right now, we are going to introduce our topic so that we get to know what do these guests have for us on this topic of discussion. Um, our question today or our concern, we would like to know, should parents really discuss about family planning with their children? Because we are seeing that many children out there that are getting pregnant while still young in school, and young boys that are involving themselves in sex. And well, as the parents, they send these children to go to school to study. They don't expect them to involve themselves in such relationships. So, do you think family planning, that parents should sit down their children and discuss about family planning? Well, okay, first we'd like to know what is family planning because our viewers out there, some of them, they would like to know what is family planning. First of all, what is it? Miriam.
So, family planning, those are different methods that someone can take. They can either be artificial or natural methods that are going to protect someone from getting pregnant or unnecessary or unwanted pregnancy or unintended. Yeah, probably that is it.
So, family planning, those are the methods people use to control or to prepare for their family. You've talked about artificial and natural. Well, I would like to know, what are those natural family planning?
Yeah, for the natural family planning, they are very different. We can have the breastfeeding method. Breastfeeding, that is for people who have conceived already. Then we have the withdrawal form. Withdrawal form, that is a form of family planning where during intercourse, the man ejaculates outside, like removes, doesn't pour the sperms inside the lady, makes sure that he removes the sperms and pours them outside. That is the withdrawal form.
So, at what age do you think that parents could sit down these kids and, like, you know what, my child, I would like us to discuss about family planning. You know, since you're now in adolescent stage, this and this might happen. So, at what age do you think that parents can sit down their kids and start discussing with them about family planning? Hi, Mira.
At 18 years.
At 18 years. Miriam?
Lower than that.
Lower than that, below 18. Why below 18?
Because children begin to engage themselves in sexual activities at earlier stage. And a girl at 18 years is more informed than the girl below 18 years. So at around 12 years, we expect a girl or most of girls to have started their periods, meaning they are at high risk of getting unintended pregnancies. So if at all you sit down with this child at 12 years, you prepare her, you tell her the incidences that can happen to her if at all she goes into unprotected sex. You talk about family planning. I think it is a better thing.
Hamira, you've talked about 18 years. Why 18?
Because at that age, these girls, most of them, they are at campus. So you find out that these girls are sexually engaged.
Don't you think that these ones who are below 18 years, like we find scenarios, a girl of 18 years, 11 years, she's pregnant, especially in those big, okay, maybe the village schools, yeah? You find a girl of 12 years, she's pregnant. Or you find a group of kids that are playing around, but you know, bazanya mama ne tata, yeah? And then you find that bazanya the other part of sex, because they see it in homes of the parents doing it. So you think that age is not needed, so that the parents to sit them down.
It is, but it is more commonly in kids at campus. Mostly those at 18 years, they are more exposed more than these ones.
Because right now we see in this era, we can find a girl of 12 years, 15 years going to a pharmacy buying an emergency contraceptive. It's true, because I think parents need to sit down with these kids. They discuss about family planning. So why do you think some parents shy away? Because when they talk about sex, some parents, when they hear, you know what, since your girl is in adolescent stage, you need to sit down your girl, start discussing with her about this and this, the body changes she's going to experience, so you need to let her know about such issues. So why do you think some parents at that stage they shy away? Or maybe the parent can take the girl somewhere to her auntie's place, yeah, to maybe the auntie to help the mother do that job. Why do you think the parents shy away?
Yeah, most of people, they come from religious families. And being religious, like, they really don't expect us to engage into sexual activity. Or they don't even expect their children at earlier stage to engage into sexual activity.
So being religious means you're getting shy to talk to your child about family planning.
That spiritual well-being doesn't allow most of the Christians to talk about family planning with their children before the
or is it because that in some religions family planning is not allowed?
Of course, and even that is.
You've talked about being a religious family. Since some of the religions don't believe in family planning, it's like God created the human beings to go and produce. So if some parents hear about family planning stuff, it's like prohibited. So when you talk about the religion, can you really tell the viewers out there, how does the religion, like parents shying away?
Like, if at all it comes back to me personally, I come from a Christian family, and I also believe you also come from a Christian family. Coming from a Christian family, just tell me, can really your mom sit you down there and tell you about family planning? The spiritual well-being in them doesn't allow. Even she says, how will the pastor hear me? Yeah?
So she would prefer her girl to get pregnant. Maybe she gives birth. Then the next time she also gets pregnant, she gives birth.
No, they don't expect their children at that age to engage into sexual relationship, not knowing that their children's body reacts.
If I told the parents get to know that right now my girl is involved in such activities, why does she really shy away?
She will definitely, like, when she gets to know that the child is engaged in sexual activity, why does she shy away? That's the question. It takes me back to what I've told you. The spiritual well-being in them, and even hearing, how will the pastor say, how will the basumba, like the old people in church, how will they hear me? Like,
but remember,
when she gets to know that my child is engaged in sex, in most cases they send them to their aunties, they send them to their friends, so their friends keep on telling the child things concerning family planning. Since them personally, they are failing to tell their kids that.
So Hamira, I would like to ask, assume right now you're a mother, you have a daughter she's in adolescent stage, and you know in such stages they're attracted to do things like engaging themselves in sex. So if at all you get to know that your daughter is sexually active, and you really need to, maybe you have knowledge about family planning, do you think you can sit down your kid and let her know about family planning contraceptives, so that you can at least save her from being pregnant or from cases of unsafe abortions when you're not aware about it?
Yeah, cut now for us when you come to culture, from Buganda. So we always send our kids to their aunties. So the aunties orient them.
Assume the auntie is not there.
I can't assume the auntie is not there.
Yeah, let's assume the auntie is not there. And now this is back to you. It is back to you. This is your own daughter. Okay, maybe the auntie might be there, but she might not do a good job as you would expect. So, like, don't you really sit this kid down to let her know about family planning?
No, according to our region, you will find that family planning is prohibited. So we will be like, how will I tell my daughter about family planning? So you end up sending the kid to either the counselor or...
But right now people are informed. And for me, I guess I can sit down my daughter. Yeah. Why? We are informed and we know that our children are exposed to different medias. They're exposed to TikTok. She will find a Lydia pill. She will find an IUD. She will find... So, to me personally, I can sit her down.
Because we are forgetting about these kind of peers. Remember when we are in schools, we are taught about family planning, right? Right away from primary 6. When you start studying about reproductive system, there is that part of family planning. You join secondary, they talk about family planning. When you reach higher university, you talk about family planning, depending on the course you're doing. So you're also forgetting these peer friends that kids might be having. So the kid might be like, my friend told me there is emergency pills. If I get pregnant or maybe I visit my boyfriend, I have unprotected sex, I use emergency pills. So the parents, you're forgetting that even if you shy away, but the daughter is well exposed. So I would like to know, why do you really shy away?
Why we shy away? There are different reasons. Why parents do shy away. First, a parent may not be informed. Like, let's talk about a parent who comes from village. Down there deep, that parent may not be informed about family planning. So remember, these girls, when she comes to adolescent stage, she knows how a different method is used, how it is, where it is inserted. She knows, like, she has been exposed by the peers. People have tried to talk about them. And for you, the mom of the village, when you come along to talk about what? Family planning, she will really see, this mom is not informed. She even doesn't know the IUD. You get? So sometimes that less knowledge that parents have make them to shy away from talking about family planning. But if these parents are informed, like if the government organizes some groups to go and really talk about family planning down there in the village, these parents will gain the confidence of coming up to talk to their children about family planning.
So we've seen different kind of organizations. We've seen different kind of groups of people coming out, holding different sessions in the communities talking about family planning. For example, Coherinate, it holds different sessions in the communities within different target groups to talk about family planning, sexual reproductive health. So do you think there are some of the benefits of involving children into family planning options? Like maybe there is a session somewhere and then the parent, you had something like, it is in Daruchai Seo, people of this village, you're going to meet at the chairman's office. There are certain groups of people that are going to come talk about family planning. Would you really like to send your child to go there and get some knowledge, or you'd like, my child better stays away, there's no benefit? Let's go in for a short break. We shall come back. Thank you. Welcome back from that short break. Don't forget that this is the Pillow Talk Show. And before we left, we had a question to my guests that if at all you got to know that there is a session that is going to come in the community, and this session is about family planning, would you really advise your kid to go there and get knowledge about family planning, or you just hide the kid away, you tell the kid to stay home? So I'd like to know, Hamira.
I would not incite my kid from going to get that family planning. Just help her not to get unwanted pregnancy because she's already sexually active. So I would just tell her, go and you get the family planning.
Support her to get knowledge on family planning. Really? Because you've told us that the religion prohibits.
Yeah, the religion prohibits, but I said when my girl is 18 years, I can't stop her from having sex.
I would like to know if she's below 18 years and she's sexually active, you get a chance of getting knowledge from a certain group of people that have visited their community. Do you really stop her from going there because she's below 18 years?
Yeah, for that case, I will stop her.
Mine, I would allow her to go there because I know that scenarios that really happen in schools. The child can be raped. That not even being raped. Do you know in schools, there are some jazzes that are held in dormitories down there. Yeah. So your child will have the urge to.
During even dances, they can hide somewhere and have sex.
You know it very well. They can hide during dances. They have these people who push the peers. Please, you go. You try it out. You get.
You can escape from boarding and go. That's that weekend. Amira.
For that age, when the reason as why I stop her from going for family planning, she will be exposed. It does not stop the kid from having STIs. So when the girl knows that I'm protected, so for her she will just go live. So you end up with having HIV, end up having other STIs. So I will stop her.
Says you tell her the consequences. Like you tell her family planning is good. However, if you go in it, let's say you have gotten an implant and you go have unprotected sex, you are at risk of HIV. Remember, it doesn't protect you from HIV. It doesn't protect you from STIs. It may protect you from unintended pregnancy, but remember, HIV is lifetime. Meaning, if you contract HIV, you will suffer the whole of your life. That is it. So for me, I would love mine would go, get the knowledge, because even if you don't tell her, she will explore on internet. Yeah. She will explore from the peers. So it is good you tell her.
Because I believe that some of the things right now we are doing as we people here, but we learned them our own selves, not the parents telling us. So I would advise, or I would like to let my fellow guests here that Amira, because we've seen that these kids, 12 years, right now children are exposed. 12 years you find a daughter or a girl doing something really apparent you can't do or you really don't know about. So I guess that if at all we get such opportunities in our communities, that there is a certain group of people that have come, especially those parents that shy away, because we have these parents, how can I really face my child talk about sex? You know, Mnage, when you go there, you have to wear a condom. Now, you see the condom, you have to put it on like this and this. Some of them, they feel shy. So I guess at least in such communities, if there is a group of people that has visited, like Coherent, coming to Ket Falau, I guess I would advise some parents to go, send their kids there, at least to get some knowledge. So when they're back, at least you can let them know, what have you learned from there? Then from there, you can get the courage and to start from there. You get something. Do you think parents should decide for their children the family planning options? For example, I can give a scenario. We've got some knowledge from Coherent. They've talked about family planning. We've got to know all the methods, the artificial and the natural methods. So I come back home. I tell my mom, we've learned about this and this and this. And then, mom, I'm sexually active. I have a boyfriend and, I love her. I love him so much. I can't stop it. The feelings are high. Mom, okay, sometimes I resist, but So, mom, do you think I can also go for family planning? So, okay, I would like to talk to you, mom. Okay, what kind of family planning can I have? Since at least for you have knowledge about it. They've talked about there is an emergency pill, but you are supposed to take it 3 times in a year. Mom, there is IUD, that one. There is this one and this one. So what option can you advise me to take? Is it a responsibility to decide for the child, or it's a child to take control over her own body?
When it comes to me, I think the child should take control of her own body. Why? There are some consequences that can happen in future where this child may not, or where there are some other attributed factors that can cause a child not to become pregnant when she gets married. You get? At that point, the child will just say, it is mom. Let me use the hormonal method. It is mom who told me that use the hormonal method. Now I've taken time. I'm not getting pregnant. Do you know there is a scenario when one day there is a certain girl who came to me and told me, Miriam, do you know my friend have been swallowing pills? Like at my early age, my dad used to give me pills before I got married. You get? Now I've spent in marriage 3 years. I'm not getting pregnant. But I'm attributing the factor to my father. If at all he didn't give me these tablets he used to give me, because he even described them, but they were brown in color. But I'm just thinking that my dad, the tablets he gave me, they're the ones making me not to conceive right now. You get? So to my view, parents shouldn't. They shouldn't.
To my view, parents should. Reason being, since you stay with your kid, you know how your kid takes care of her life. So you'll find a scenario whereby your kid is like, Mom, I want to use an IUD. But you know, well, your kid is too exposed to infections, is too exposed, is very dirty, and IUD does not need people who are so dirty, who don't take care of themselves. For that case, your child may end up using an IUD that may affect her in the future. So if you know that my child is not hygienic well, I would advise my child to go for other family planning methods.
So you would choose that option for her?
I will not choose, but I will emphasize her at least to use other family planning methods. Yes.
And that means that you have to go to her, you have to go with her to the facility. Then you're like, doctor, I would like this girl to get an injection.
But can you really take your daughter to a facility? Do you know some government hospitals, when you reach there, these nurses, they can act as if they know more, like how it's weird. Like when you really go there, the nurses act like it's really weird. How can a parent bring a child below 18 years to initiate the child on family planning? Meaning that either this parent is sending the child for sexual activities for her to earn money, or this child is highly active. You get? So it really becomes a tug of war for parents to really go at the facility. This like the attitude that parents earn at the facility, it really doesn't allow them to go there. At least it is better you send it.
So because Hamiraz says that for her, she would not some options. She would not advise her daughter to do such things. So that means that you would let her know about that there is an injection, does this and this and this.
I would let her know about other family planning methods according to her hygiene.
To her hygiene. Yeah. What if I decide myself I want this? You would stop her?
What if you decide, you can't stop her, but at least you try to teach her. You tell her this and this is not good for you. Try this method.
Abaana balina emputu. Asalawo n'akola ky'ayagala. However much you talk to her.
Mommy, I want a family planning. She has already chosen the method already. That by the time she comes to you, Mommy, I have a boyfriend. And even coming to you, it depends on the relationship you have, my dear. Children, keep quiet. You find a child with this implant for 5 years, but you really didn't know about it. The child is at 18 years.
So it also depends on the kind of relationship the parents have with their children. Because we are hearing, we find this kind of mothers or fathers, they really don't have what can I say? They don't really have that kind of unity or bond with their children. The dad just wakes up in the morning, moves out of the house. The mother just comes back during the night, does whatever she's supposed to do, then she goes for sleeping. Then you find this little girl. She has no time for the mother. The mother also has no time for the girl. So they do things at their own way.
That's very right.
Oh, Jesus.
So that bondage, the bond that you have between the parent and the child, it will define your child's ability to come to talk to you about family planning or even having a boyfriend.
If you're not bonded with your child, she'll never come to you But if you're bonding with your child, that's when the child will come to you, Mommy, I want to use this family planning. What should I do? So
I'm just free with my mom. Even if I get someone, I go straight to her.
Sure.
Very sure. I reach there, Mom, there is this guy here and here. He's saying this and this. And from primary, like from my secondary life, she tells you, no, that you're not ready right now. You go for your books and you'll find a better person.
And right now you're ready.
Right now I'm ready. So I even go back and tell her, Mom, you know what? Yeah? I really got someone and he's like this and this. She tells me, Miriam, you know what? Look at that guy, it's so clear. Do not engage in sexual relationship before this and this. Yeah? You get, for you to initiate the conversation with your child, my dear, you must have a big bondage. You must have that bondage.
So about the benefits, you've talked about that there is maybe prevention of unintended pregnancies. Hamira, what kind of other benefits do you think parents can get if they involve their children into family planning?
in case you tell your child to adopt family planning method, you find that the child, putting aside intended pregnancies, you never get school dropout, whereby she will never get pregnant, because in most cases, people who leave their school, it's because of pregnancies. You know, schools can't adopt kids with pregnancy, so she may end up going out of school.
So she will enjoy her sex after all she's on family planning while still in school.
And by the time she gets married, the man doesn't even want the things anymore, because everyone has enjoyed it.
All right, let's go for a short break and we shall come back. Thank you. Welcome back from that short break, dear viewers. Don't forget that you're watching the Pillow Talk Show, and I'm still with my guests, Hamira and Miriam. Before we had left for a break, we are still discussing about the benefits of involving children on family planning. Miriam, what other benefit do you think that is really good for involving the children on family planning?
To me, the benefit is it reduces the financial burden of a family.
Sure. How?
How? Just get to know. You are at home, you have 3 girls, let me say 6 girls. One comes home pregnant. You get, you're to take over the responsibility. Another one comes home pregnant. You're to take over the responsibility. Up to the 6th one, they all come back pregnant. Remember, they can't even go to their boyfriend. First of all, the child will get pregnant in a boy who, let me say, who sells chapati, who can't even take
Who even run away from that village?
That is very true. A border guy who is going to run away. However, if I talked about family planning with my children, they will get to know I will have reduced the burden, meaning I will not have grands at unprepared age. Do you know these grands, you have to buy them milk every day. You have to buy them diapers. You get? So that burden, you have really reduced it.
Really, I didn't know that family planning reduces on the financial bit. I advise young girls out there to go for family planning. Otherwise, you will spend a lot. Hamira, you will spend a lot. Did you know that?
Yeah, you spend a lot, because that baby, you have to buy diapers, milk, medication. And you know what's funny with those little kids? There is the way they over get sick, yeah?
They can become sick from Monday to Friday. You go to the hospital, take it for the first daughter.
Moreover, you're still young. You also need to take care of yourself.
You begin cursing yourself. Now I gave birth to daughters and I'm now a granny at 33.
You're regretting.
So you should take your
you take care of your kids, you take care of your grandkids also.
So do you think that discussions around family planning promote bodily autonomy among youth? Because body autonomy, this is like you're having choice over your own body. You decide for your body. You take control over your body because it is yours, not for any other person. So do you think these discussions around family planning promote body autonomy?
Of course they do.
How?
A child will definitely know. Remember, I discussed with my mom and we agreed not to go on family planning over to go on family planning. She told me if I use an implant, I'm not protected over STIs. Meaning this child, even if the boy comes and says, let me go have sex with you, like these hush people, she will definitely say no. You get? She will say, no, I'm not going to have sex with you.
Or would rather use a condom.
Or we would rather use a condom. She will be confident because she knows what she's talking about, and she knows what she's going to do. She knows the risks that may come, and she knows everything that, like she's updated. She knows the consequences. So it promotes really.
Hamira, what do you think about that? Discussions can promote body autonomy.
Yeah, it does, whereby you find the scenario that one used injection. So when the injection has expired, the girl has not yet gone for another injection. So she will stop that guy from having sex with her. No, you know what? Let's wait. I'll get pregnant in case I have sex with you. Reason being, my injection got expired. Yeah.
So in case if at all I also get pregnant, I have a choice over my body, either to keep this thing inside me or to remove it. So family planning promotes body autonomy. Oh, wow. So can also discussions about family planning prevent children from having unplanned pregnancies, unplanned sex, and unsafe abortions? Do you think they really prevent such stuff?
Yeah, they do. Unplanned pregnancy, when one is on family planning, so she will not get unwanted pregnancy. Not until she leaves family planning. That's when she would decide, let me get pregnant at this age. Unsafe abortion, when you're not pregnant, you will not run to unsafe abortion. Yeah.
The question was like, discussions about family planning prevent unintended pregnancies and unsafe abortions. For example, I would give a scenario. You find yourself that maybe I went to family planning, I got an injection, and maybe it got expired without me knowing. So I find myself that I'm pregnant. How can I really prevent that from getting unsafe abortion? Because we've talked about body autonomy. So someone will be like, I got pregnant, but then I had told my mom about family planning. If I tell her that I'm now pregnant, what will she say about it? I think I'll do this because of bodily autonomy. I'll go do unsafe abortions because she doesn't know anything, or I'll go do safe abortions because she doesn't do anything. She doesn't know anything.
Still, it comes back to us. That conversation of mother to child. Mother about family planning, the bondage it created, meaning even if this child goes outside there, she gets unintended pregnancy, she will definitely run back to the mom. Of course, when she comes back to the mom, as a parent, you have to provide ways, either to keep the pregnancy or not to keep it. So if you decide not to keep the pregnancy, what are you going to do? As parents are updated. Most of the parents in Uganda right now, they are updated. So they will definitely run to a health worker, a professional health worker. This will help us to reduce the risks of what? Infection. Remember, when this child runs to unsafe ways of aborting, the child will be septic and then ends up dying. She will lose a lot of blood. Remember, as a parent, you don't know. You even don't know what is happening to your child. There are these parents who just throw their child in boarding section, just comes back home in the holidays. So you know nothing. They bring the child doesn't even have blood. By the time you rush the child to the hospital, the child is already dead. However, if you had that bondage, the child jazzes with you. As a parent, you will definitely look for the right people to talk to about this, and they will help you out. So for me, I just urge parents out there, increase the bondage, feel free with your children. Just talk about family planning with them. Talk about it.
So family planning prevents the unintended pregnancies, it prevents the unsafe abortions, and also
helps these children to get their future desires. Remember, if at all you are in senior 2 right now, you get pregnant, you're going to drop out of school, meaning your future is now cut off. A child who would have learned, went to Makerere, become a doctor, now is just going to make chapati. Chapati tagenda kola ki kusobola kweyongerayo.
So because recently we've been getting news from the government, Ministry of Health. Some doctors were coming out saying that we need to put these little children onto family planning, but the government came out and said no, it's not allowed because they'll be spoiling the children. But as we are seeing the country right now, fertility rate is high, and this is most especially in young girls between 12 to 18 years who are mostly sexually active. So what do you say about the government like prohibiting family planning on these children? What advice would you like to give those people out there about this?
The government may be okay, like the government refusing, to my perception, it is okay. Why? These children must have a bodily autonomy, as you said before. Yeah? Meaning, if a child really wants family planning, let them not be forced. Let a child who wants family planning go for the family planning, and let those ones who do not want leave the
it's not about the government forcing these children to have family planning.
In case a child really comes up, be it at the age of 12 up to 18 years, let them take up the family planning. It will reduce the risks of unwanted pregnancies,
Even high population,
abortion, high population, unemployment in Uganda. So when someone really comes up and says, for me, I'm 12 years, however, I have a boyfriend, and I really like this boyfriend, but I want to be on family planning. Let it be free for everyone. Let it just be free for It won't spoil anyone. It just protects the future and people who will come up.
Amira, what advice would you like to give people out there as we are winding up?
The advice I would give to people out there, in case you get to know your child is sexual active, at least help your child adopt family planning methods to avoid further risks. Unwanted pregnancies, school dropouts, financial problems, and safe abortions.
To our viewers out there, first of all, I would still want to thank you for watching Coherent TV, especially the Pillow Talk Show. You really do good. Thank you. According to the topic we've had today, parents discussing about family planning with their children. The advice I would like to give all people out there, especially the parents, specifically mothers, because those are the people who mostly we report to maybe when we've got problems. Mom, this and this, mom, this and this. The advice I would like to give you is to give knowledge. When in case you get chances, maybe in the community there is a certain group of people that is coming, giving knowledge about sexual reproductive health, please advise your children to attend such sessions, and from there you can also add something. Provide them knowledge, I insist, because these children, even though you don't do so, the world out there will show them action. If you really don't protect your child right now, there's no one who is going to protect your child for you. So try your best, don't shy away, sit with your kid, teach her about family planning, teach her about sexual reproductive health and the rights, so that they can get knowledge. In this, we are preventing unsafe abortions and unintended pregnancies. Don't forget that this show is proudly sponsored by Auntie Kaki. Auntie Kaki is a toll-free helpline. Please, you can contact Auntie Kaki on all issues concerning sexual reproductive health. The numbers are on your screen. You can contact Auntie Kaki on all issues concerning sexual reproductive health and its rights. This has been the Pillow Talk Show. We really love you so much. Thank you for following us. All the best. Bye-bye.